Dr. Douglas Robinson, Campbell Podiatry. I'm going to talk to you about a crystal-induced arthropathy called gout. Gout is a condition that many times affects the big toe joint. It can affect the midfoot, called Lisfranc's articulation, or the ankle. This comes about because your body's not metabolizing things that you're consuming that metabolize, they're called purines, they metabolize into uric acid. So when uric acid crystals become more pronounced and more concentrated, they fester and crystallize in one of these three joints. Sometimes it's all of them. When it's the big toe joint, it's called podagra, and in Latin that means diablo or devil in the joint. This can be excruciating and come about with no real reason. It's not because of an injury. Many times it happens between like 2 and 4 o'clock in the morning. You just wake up and go, what happened? But it's the result of whatever you're consuming or because you're not consuming enough water. So things that are common that you can consume too much of, your body doesn't metabolize it adequately, especially when it's hot out, is you're not drinking enough water. You can be doing too much alcohol, especially wine, or you're consuming some seafood like sardines, anchovies, and mackerel, or you're doing too much sugar or too much red meats. All those things can cause this. If you look at the right foot, which is asymptomatic, this is called positive wrinkling. Notice how everything wrinkles real easy because there's no swelling. This is really swollen, so notice it doesn't really wrinkle that much as it does over here. See how the skin wrinkles and crinkles? Here it doesn't. The initiation of treatment for this is I numb up this area back here so you have no pain at the joint. Then I pull out fluid. The fluid should be clear if it's healthy. When it's not clear, it's kind of yellow. If you get a close-up of this, you'll see that this has a little bit of a yellowish tinge. And although I'm not diagnosing it by just showing you this, I just want you to see how yellow that is. That's going to go to a laboratory where a pathologist will look at it under a microscope, and they do something called polarized microscopy to look for crystals. That's how you confirm gout. We're also going to get a blood test. We're going to look at uric acid, 2 elevation markers called erythrocyte sedimentation rate and CRP, and also we're going to get a basic metabolic panel and a CBC. Gout can seem like came from nowhere. Sometimes the symptoms of gout is just like having a bad infection. He has no cuts anywhere, so I don't really think that's what he has. We're going to get a blood test to determine that. Once I've numbed him up and he's comfortable here, I pulled out that fluid, and then I've already put the steroid in this joint. That steroid in this joint is going to help calm this, and I'm also going to put him on an oral anti-inflammatory so he can start feeling better. And the key for him to be proactive is to identify what he's consuming or not consuming enough of and do it in moderation, but he's going to have to drink a lot more water. So I call it HBO, and that's not for home box office. HBO for me is an abbreviation for half your body weight in ounces. So you want to do that every day so you can dilute the concentration of uric acid. So the aspiration and putting cortisone in, taking an anti-inflammatory and drinking plenty of water so that when you pee, your urine is clear is the key to helping this to feel better. Uric acid is, and becoming gout is only for sure determined with the aspirate showing crystals. People can have an elevated uric acid and not have an acute gout situation. Our goal is your uric acid, we want that to be below 6. If you're on a medicine called allopurinol for long-term management, we want that target of uric acid level to always be below 6 to manage that. So that's how we take care of acute situations where you've got a swollen, hot, painful, severely painful movement of that joint. That's called gout. And a lot of people that went to this concert, which was 2 days ago, they drank a lot. They're prone to this condition. So I just saw the Rolling Stones that I love. 6 decades of Rolling Stones, all good. I'm Dr. Douglas Robinson. This is how I take care of acute gout.